Well, I would say for the practitioners, stay steady, the steady state. There was a lot of flurry in Washington about the repeal of the ACA and to replace it. I don't think that's going to happen. The bottom line is the ACA is still the law in the land, and inside that, and even before we had the ACA, there's a lot of rules that existed, particularly in Medicaid, for states to have a lot of opportunity for innovation. And the practitioners who are working with their clients also have a lot of opportunity to work on innovation within the state structure that existed previous to the ACA. The ACA expanded on it, and nothing to date is going to change that. And I think it's unlikely that we'll see anything in the short term. So the focus really should be on doing what you can with your clients to expand opportunities to be more innovative and outreach, increase the client base, and working with your clients and using technology more efficiently to drive the cost of healthcare down, expand healthcare reach, and improve access. From a practitioner point of view, the clients continue to have to provide care daily, and the issues are very real. And so if it's going to happen, here's what I would tell our clients, and here's what I would tell the lawyers. You need to be ready just in case, and to have that conversation by looking at the pending legislation, to have those dialogues with your clients, and still manage the day-to-day. And so what we know with anything that's coming in the repeal and replace, there would be a reduction in the number of people who are insured. So the conversation I'll be having with my clients is, are you ready to deal with an increase in the uninsured? Are you ready to deal with a reduction in reimbursement, if that's going to happen? And to have those conversations at the provider level and at the state level to make sure they have a contingency plan to deal with the impact that may have. And it won't be immediate, but it'll roll in over time. So you have to have that parallel conversation. So staying educated is a key thing, and making sure that you're having those conversations with your clients. Coming to association meetings like this, or even affiliating with our association, is a way to stay connected and understand what's happening in the law. And in parallel, continuing to manage what your clients are doing today. And that's understanding the status of the court cases that are also driving change, working within your own state and with the providers who are engaged in innovation and using technology, because all those things are going on and all those things will continue to progress. Using technology to innovate vis-a-vis telemedicine, it's always going to happen, and moving forward. Using your own data systems, your own data analysis and data analytics to understand patient migration, patient care, and how you're managing your reimbursement, that's always going to exist. And the better able you are to manage that, you will be able to manage the changes in the health law system that may come, if it comes, in the fall or in a few years. The market, the innovation market, the technology is driving the change. Back in the day, you might be able to wait for the state government or the federal government to tell you what you can do. And you would wait patiently for them to turn on the green light and give you a thumbs up. In today's market, with the way innovation is driving change, innovation is ahead of the government. And the government does need to catch up or get out of the way. Catch up to understand how innovation can be used and harnessed, or recognize that we don't need to regulate in this area. Let it go. Don't harness it. Don't try to restrict it, because the demand from the consumer is for more and more technology, more and more immediate access to care. It's 24/7, it's 365, it's in my home, communicating with a provider or a clinician through my phone, through my technology. The days of I'm going to get in a car and some mode of transportation during business hours to go and seek care from 9 to 5 are gone. And it's the consumer that's really driving this. So as much as the government has a role to protect and ensure, the technology is moving so fast, they can't keep up. So they have to take a different position, which is a little different for the government. They have to monitor and manage, help and support, but they can't block, they can't get in the way. They have to get out of the way and be more of a partner.